Acupuncture is a traditional Eastern medical therapy that's been around for thousands of years. It involves placing very thin needles at different points on the body, and it encourages the body to return from a place of imbalance to its natural state of balance or homeostasis. And today on Lunchtime Live with the Center, Helen Betke Vargas is back with us, and she used to be she was a former embryologist and a licensed acupuncturist. And she's here today to talk about how acupuncture can support your IVF cycle. Hey, Helen, how are you? It's so lovely to see you again.
Hi, thank you, Ami, and thanks the center for inviting me for a chat. But I do want to start before we embark on any questions that the quote that I always remember one of my teachers would say in training in specializing in fertility and acupuncture is that the quote says, prepare the soil to plant the seed. And this is for both men and women. We have to prepare the soil to plant the seed. And the other deep concept of Chinese medicine, which is Eastern medicine, and it has a philosophy of like 5 element, like everything is looked through these 5 filter. Like if I have a patient, I see what is their constitution. And it's about living in harmony with nature, living in harmony with our environment. And that's the other piece that's very important that I bring more into my practice, especially having been trained by my mentor. Ongoing training is alchemical acupuncture and Taoism that says like now we're entering fall. We can tell the energies are slowing down. So therefore, with that energy, we need to nourish, slow down a little bit, sleep more, rest more. And then, of course, is winter, but living in harmony with nature.
So this harmony, that's lovely, first of all. Harmony and balance. How does what you do, how does acupuncture help create that balance?
It's a very good question. And it is basically after the first appointment consult where there's a big intake and in some traditions, we do abdominal palpitation, pulse, and looking at the tongue at times to see what is out of harmony and what systems we can bring more to balance. Whereas Western medicine specializing in fertility, like at the center when women are a couple, they come, their blood works is tested, their semen analysis is done, to look at if the tubes are open or not. So those things, if the uterine lining is good, if you're ovulating, all of those are looked at. In the Eastern tradition, in Chinese medicine, which is so, supportive of Western medicine, and they go well in hand in hand. It looks at the whole picture. It looks like, how's your sleep? Do you have pain body? Like, is it not Eckhart Tolle pain body, although that too, but like, do you have back pain, migraines, neck issues? How are your cycles? Everything is looked at, okay? How is your energy level? And acupuncture is cumulative. So as I work with patients, whether men or women, is your sleep improving? Is your energy improving? And then we look closer. How is this cycle? If it's irregular, does it start becoming more regular? If you weren't ovulating, is this happening? Because certainly there are numerous studies done, and some of them that really show us how it may be working. We still don't know how it works, but how it may be working. It shows that it works through the nervous system, the HPO axis and HPA axis, which is how hypothalamus pituitary ovarian axis, for example, is how brain communicate with ovaries. So we know those, but again, we don't know exactly how. We know that acupuncture with IVF shows that it improves pregnancy rates. Done as a whole system, the way clinically is done, a series of treatment, at least 9 to 12 treatments. The pregnancy rates are higher, the miscarriage rate are lower, but there's some shifts happen hormonally as well. So those are research that are ongoing and from the past and present.
So you would say that you- it helps with IVF because it helps create a balance of hormones. It
That
helps
too.
with hormonal balance. How,
We
is
can
that what you mean
we
also?
can say that, like, and I was a researcher and an embryologist. That's how I began at the endocrine fertility as a research assistant first in 1984. So I look at the research a lot, and some of the research that are really standing out is like Dr. Stenner's study that showed in women who were not ovulating or haven't had periods for months, and in PCOS patients, they did a lot of research on that, and a series of 8 treatments brought on ovulation, brought on the period. So we know hormonally is doing something. And in other studies with IVF, the lining, like it shows that blood flow to the uterine artery increased. Uterine artery pulsatility was improved. So if there's more blood flowing, then we are speculating that it could mean that better nutrients to the ovaries, to the follicle,
Mm.
and the lining. So for implantation and egg quality, that could be a reason how it's helping. And a more recent study, Lee Hollander Rubin, who's a great researcher and an acupuncturist as well, that she showed that she did one a few years ago about whole system, that it does better. She did a group with whole system for IVF, a group just pre and post, and a group with no acupuncture, which is a great study. And the
Mm.
group with whole system did much better than just the pre and post, the one-time acupuncture. And of course, the group with pre and post did better than with no acupuncture. But her recent study at ASRM showed that particularly women who are older benefit greatly from acupuncture. Women 38 and older actually showed even better improvement of egg quality or pregnancy rates.
Why do you think that is?
Yeah, good question. We think it has to do with, in Chinese medicine, it's called the kind of energies required for fertility is the same as longevity.
Mm.
And that's our gene. You can think of it as our sort of that epigenetics, genetics, okay? We know we can't change genetics, but the epigenetics says if you change the environment, you can you can change that, okay? So we think that's the way it works. Chinese medicine certainly shines in longevity, improving. A lot of people do it just for well-being. And there was Dr. Magarelli showed us a study done with Chinese herbs that shows like epigenetic markers were changed. So we think it's that because that root energy, which is, we often refer to it, the water element or kidney energy, it greatly improves. We can, and the younger you are, of course, the better your chance. But
Right.
we need a little more.
Right. And you mentioned that a series of treatments can be good for IVF, for good for fertility, and you mentioned 8. I mean, just as a number, is that 8 over 8 weeks? Is there a certain amount of time that you um, think is think of as optimal?
Yeah, treatments are done different. Practitioners done differently. I usually stick with once a week treatment. Some offer 2 or 3 treatments a week. The treatments are cumulative, and yes, the study, particularly Dr. Stenner's study in Sweden, there were 8 treatments over a course of 1 month, so 2 treatments a week. Okay, and that's also have been researched more and done with Dr. Magarelli's practice, and they're also done in weekly. It is cumulative, so clinically, that's how we do it. But
Mm.
the most recent study of Lee Hollander Rubin, this whole system showed like about 9 to 12 treatment. Often they say 3 cycles,
Mhm.
um, which is like about 3 months. Yes, I don't know if I answered questions.
Excellent. So when you mean cumulative, you're saying that each of them builds upon the other. It's like a compound effect, if you will.
Yes, and I can see that even with pain. But like I had a patient recently who had sleep issues and a really low sleep. And after the first treatment, she said the first 3 nights she slept really well and her energy was high. And then
Mm.
and then after the second and third treatment, we started building where like her sleep was much longer periods of time. and the energy was lasting longer. So eventually,
Oh,
it was rarely, those sleep deprived nights would happen once in a while.
we said so. Logistically, it involves really thin needles. Can you give us an idea of what that would look like? What
Sure,
it?
sure. So needles, they come in a packet, or they're sterilized same way as medical equipment are sterilized. They're one-time use. So because I myself am a bit needle sensitive, I like thinner needles, so that's what I use as well. And I use more of a Japanese style of treatment or needling. Let's say I use a combination of TCM and five element and others, but I like thinner needles, and I like not to feel them. And this is a Japanese needle, and I use Japanese and Korean, so they're very thin. They're like, I don't know if I can bring it. They're like, okay, there you go. They're hair thin, and it's
Wow.
best to think of them as antennas. Really, they have a tube to guide them. That was a Japanese invention. Before, they used to just go in, but this is, let's say it's threaded here, and I just, oh, there we go. I know, because of when it wasn't COVID, I used to show it on people, but so, and then you put it in. But this is, look, it's so,
You barely
like,
see it,
yeah,
right? So thin.
I don't know where I am. Okay, there you go. Yeah, they're hair thin. They're like, often you won't feel them. Some you may feel like a pinchiness or mosquito bite, and then it should go away. The sensation goes away. Rarely, it's it stays, and if it does, I say I'll remove it or redo it. And with
Mm.
first appointment, I go one needle at a time, just like get acquainted. And I feel for if a patient's like me, needle sensitive, I do less than more. Otherwise, with fertility, there's a handful of them on lower abdomen and lower back often, and other, depending again, with each patient is different, and where they are in their cycle is important, and where they are in their IVF or IUI. What are we promoting? We're promoting more blood flow to the uterus, or we're promoting movement of chi. If it's during the period, we want to move things. That's how it works.
Got it. Okay, so you talked about sessions before actually going into your cycle. What about during your cycle? Can we talk a little bit about how soon after a embryo transfer you should do acupuncture? Should you do it before also? And does it increase like implantation rates?
Yeah, so that is a very old study in 2002. It's called Paulus study, and that's actually what made acupuncture in conjunction with fertility very popular, because in the advent of computer and research, people could research. They found out there was such a research done, and it was done for the practical purposes of they couldn't do a whole system the way clinically all of us do. We do a series of treatment, and then they just wanted to see IVF and acupuncture. And why they picked that day for a long time, it was baffling to me. Why day of transfer? Well, day after transfer is the most sensitive day. You're most anxious, most excited, most nervous, and it's a very special day. That day you receive the embryo. It's a huge day. So I realized that's actually a good day to have acupuncture. Anyway, the study was done right before and right after, and it showed that improved pregnancy rates by 20 to 40%. Okay. Earlier studies, the percentage were much higher. It's just that what is happening then, the pregnancy rate were about 26%. We were talking about 2002 in most fertility center. Now, like our center is like 50 or 60%, right? So,
Yeah.
so because of that, yeah, but still, that still shows. But again, now that we've had much more research done, that a series of treatment before going into IVF, at least about, I want to get 8 or 9, but the 3 cycle is also good. Having said that, I meet my patients where they are, because for some, couple of treatments will do that where we are. It's almost like, is it good with or without? Of course it's with. It's like I tell them, it's like a marathon runner, you're preparing to, like, oh, I want to do that 5K and it's in a week and I haven't prepared much. Should I sleep better, eat healthier, go every day for a run for 5 minutes, 10 minutes, or not do anything because it's too late now? No, of course. Anything you do is better.
Something. Oh, I like that analogy, that metaphor there. Um, so, how you see a lot of center patients? How do you work with them? Do they come to your office, or what are How do
Yeah.
you?
Yeah, so my office is right down the road from the center. It's about less than 2 minutes. Okay. And the piece that working with patient center and that they refer patients to me because I was an embryologist in the past and I'm an affiliate acupuncturist, is that there's a familiarity. I know the physicians. I worked with them, with some of them since 1984. And I have the familiarity of what goes on in the lab, what goes on. And so they have those questions to ask, and um, we are on the same page with each other. So just that familiarity brings a sense of comfort to a lot of patients from the center.
Certainly does. Do you also work in the centers, in the facility, or do you mostly just work out of your own office?
I work in my own office. The center has from the beginning offered the option of doing the pre and post of that on that same day, right before your transfer and right after, an option to come there. Of course, since COVID, that has been a bit we're not doing it
Yeah.
as much, or in the beginning, we didn't at all. Again, my office is so close, but that's definitely an option.
Okay.
It just has to
And
be planned ahead of time.
okay. So they could call you. You have to plan it ahead of time, assuming everything works out.
Yeah, and we have to have
Schedule
like
wise.
we have to have that initial consult. So I don't want to take anyone into a pre and post never having had acupuncture. You don't want that. You want to already have had a treatment or two at least to know, is this something that will relax you? Rarely someone will say it may not be for them. I think in the 15 years of practice, I've seen one person at the end, they were like, no, and that's great. And there were two patients that I actually asked them that I think this is not the best. You get very tense. It's not useful then. So I
Hmm.
wanted to do it because they were like, I know it's helping. And I'm like, it still has to be a pleasant experience. And often, I would say 99.9% of my patients, once the few needles are put in, they go into a state of very relaxedness because a lot of endorphins are released. We know that from, there are many studies that still show how it's working, but we're not totally clear. But like one study that did an MRI of the brain, and a point that in Chinese medicine is used for eyes, it's on one of the toes, was stimulated, and that area light on the MRI. So that's
Oh wow.
fascinating, but we don't know. Uh, and I'm sure one day we will know the
Yeah.
same.
Now, final, one last thing I wanted to just ask was, you see mostly women, I imagine. Do you also see men in this journey of
Yes,
fertility
I also
and
do
treatment?
see men, particularly men with any issues with their semen analysis, like sperm motility and count, particularly, and some with morphology. Uh, so, actually, a more recent study showed that about 5 or 6 treatments help improve motility and count in men who had very low motility and count, or in their of their semen analysis. So yes, men come as well. Not as
Excellent.
many as women, it's but they do.
Yeah, I was wondering. I was curious. Of course, this is both partners are involved here, so I didn't know
Yeah,
if.
it takes two. And from last time I was in the Integrative Fertility Symposium in Vancouver, both last times that we could attend in person, a lot of attention was being given that we have to look more. This was from perspective in Western medicine that look, it takes two, the sperm I remember one of the male fertility experts said that a healthy looking sperm doesn't mean is a fertile sperm. So yes, that's important to remember that. So
Excellent.
all the lifestyle changes. So Chinese medicine is about acupuncture, herbs and supplementation, of course, and nutrition and lifestyle changes. So that's one of the things I say, whatever I'm suggesting to you, and some couples come together, which is lovely. And even if they don't come together, I say, share it with your husband because he needs to also eat healthier, have more
Mhm.
of de-stressing, also avoid alcohol, for example, as much as you can, or reduce coffee. Um,
Yeah. What's good for one is good for the other.
yes. I wanted,
Oh,
if you're,
excellent.
I wanted to end with a practice that is very relevant to this time in fertility, and
Okay.
and that is, we are in a metal element of Chinese medicine, and fall, the season of winter, and this is an aspect of fertility that I pay a lot of attention to, and that is hope,
Mm.
hopefulness. Because without hope, we can't keep going, and hope is about being present, okay, in this moment and taking in. So let's take a few breaths. Let's, for those of you who are in with us, put your hands on your right over your heart and your lungs, and just as you're breathing in, notice that in breath and out breath, your chest rising and falling. And let's invite an element of hope with each breath. What am I hoping for? And if you're in a cycle, how would I like the cycle to be? And hold that image in your heart, however would you like it to be. And with that, I will end with this affirmation that are on my affirmation cards that I have them in my office and I've presented them before, that says, may I conceive with ease.
Mm.
May I have a healthy pregnancy, and may I have a healthy child. Let's take one more breath and invite hope. And with the out breath, let's let go. Let go of anything that may be in the way of us feeling fully hopeful. All those elements of fear or anxiety. Can I just let them go for one breath and be present in this moment? That it's this moment, everything is okay. Again, one more breath of hope, inviting hope and exuberance for this next cycle that you're going, and whatever decisions you're making in your fertility journey, because sometimes those journeys are short and sometimes they take a while. And it helps to be present. The more you're present and hope, the more you can carry this journey with ease and groundedness so you can make the best decisions for yourself. And one more breath, and then opening your eyes. And
Lovely. Thank you, Helen. Helen, um, how can someone contact you? What is your website?
my website is acupuncturetreeoflife.com. That's the website. Well, Acupuncture Tree of Life.
Okay.
And all the information is there. And often people call, ask questions, and I'm happy to speak with them and any information that they need so that they can make the choices for themselves.
Excellent. All right. There is one question that I do want to just mention, the cost of a sperm analysis. I would recommend contacting our office. You can go to yukonfertility.com and you can contact our office through the phone numbers at the bottom of the screen. They can talk to you about self-pay options. And Helen, I just want to say thank you so much. It's always wonderful to see you and have you share here. Your work is helping so many people.
Thank you. Thank you. Thank
You're welcome.
you, community, and everyone have a beautiful day.
Thank you. You too. And be sure to join us next week or next time on Lunchtime Live. And in the meantime, check us out at yukonfertility.com. See you soon.